quest for health sovereignty and self-sufficiency in medical product manufacturing. This is what we are discussing this morning as the 7th Scientific Conference on Medical Product Regulation in Africa is meeting in Mombasa, Kenya. The summit is looking at how Africa can produce its own medicine. The continent currently imports over 90% of medicines and over-reliance on external supply chains that leaves Africa vulnerable. The conference, which ends tomorrow, is where the African Union Development Agency, NEPAD, or AUDA-NEPAD, and its partners will define the next phase of a future of medicines production in Africa. To discuss this further, we're now joined by Alex Juma Ismail, who is Senior Program Officer for African Medicines Regulatory Harmonization, or AMRH, at AUDA-NEPAD. They're facilitators of this conference. Alex, a good morning to you and thank you for joining us.
Good morning, and thank you for having me.
Our pleasure. So the Conference on Medical Products Regulation in Africa, or SCoMRA, is now in its 7th year. What will form part of this year's agenda?
This year's agenda is mainly, we are looking at trade through local production and harmonization of requirements for medical products in Africa. And we have 3 days of conference where these 3 themes of this year's conference also bringing together, these experts from across the continent, leaders, and they're spread across fields of expertise. We have manufacturers, we have regulators, and we have industry, and also we have policymakers from the African Union Commission and also from the member states of the AU to discuss and forge a way forward that we all important things that will be implemented as we are transitioning from a program of harmonization to a continental agency which came into operation in 2021.
Why is it important for the continent to produce its own medicines, and what are the impediments for us reaching this goal? What factors contribute to the slow pace of Africa's ability to do this?
As you indicated, Africa imports over 90% of its medicines and over 99% of its vaccines. And we saw during COVID, if we, God forbid, we are in a position where we are facing another pandemic, then continent will not be sufficient to secure the public health of its people. So the African Union has been very deliberate in these efforts. We are looking at producing. So we established what we call the Partnership for Vaccines Manufacturing in Africa, PAVM, and also the Pharmaceutical Manufacturing Plan for Africa. And in terms of vaccines, we are looking at producing at least 60% of the needs by 2040. It's a very ambitious goal, but the entire continent is very deliberate, and we want to ensure that we are secured when it comes to these essential medicinal and medical products on the continent.
So who is going to be in attendance at the conference to participate?
So we are hosted by the government of Kenya, the Ministry of Health, and it is being represented here by the Farmers and Forests Board. We also have in attendance representatives of the head of state, Honorable President of Kenya, will be represented. We have the chairperson of the African Medicines Agency Governing Board. We have the Director General of the African Medicines Agency, Chief Executive Officer of AUDA-NEPAD, Continental Development Agency. We have heads of agencies. These are agencies responsible for medical products regulation Africa. We also have representative of international industries, manufacturing industry, also local manufacturers from within the continent, academia, and other policymakers representing other international organizations. So we have almost everyone participating in this conference this year.
What is the importance of regulatory systems in enabling or the manufacturing of pharmaceutical plans for Africa, and how should they be strengthened?
So when you talk of regulatory systems, you're looking at an environment where the products that are being manufactured before they are accessed by the people, they are of acceptable quality, safety, and efficacy. And having a well-integrated, strong or stringent system ensures that not just any products would reach the people, but the products that are of acceptable standards. And in Africa, when we started this pharmaceutical manufacturing in 2005, and the implementation at the time was decided to be a stepwise approach, where we realized without having an environment, regulatory environment that is speaking to each other, is well coordinated, and it's strong, it will be very difficult to realize this long-term manufacturing. So we created the African Medicines Regulatory Harmonization 4 years after the adoption of this plan. And then we had an opportunity to bring all the countries in Africa to start harmonization of requirements. Meaning, so before 2009, what it meant is if a manufacturer, whether located in Africa or outside Africa, wants to have their product in African markets, they would have to navigate 55 different requirements and different systems, which is very time-consuming, source-intensive, and that would mean also prices and increasing cost of these medicines in the market. But now with the harmonization and creating a one block when it comes to regulatory requirements in Africa, that means there's a possibility, which has actually been proven, that you can have a single submission of the data from studies that and the development of these products. You can have a single review, single inspection of the manufacturing site, and then have an outcome that will be applicable to multiple countries. So if the manufacturer is then interested in the entire continent, then one single review, one inspection, that would mean access to 55 markets. So this is a game changer. And we've seen this working with the pilot that we were running for the past 2-3 years. And so strengthening systems is something that is very critical. And for us to have functioning healthcare system, then it means we need to also have a functioning regulatory system that would allow for these products to circulate while maintaining their standards, quality, safety.
I mean, so that covers then what my next question was going to be in terms of how to harmonize within the different regions where these regulatory systems need to be implemented, the likes of the ECOWAS, the EACs, and the ECAS and the IGADs. But let's talk about capacity strengthening then over and above harmonization. How should those be implemented to make sure that these regulatory systems do get strengthened on the part of capacity?
So it's very important to have sustainable capacity development mechanisms or systems on the continent. And in Africa, we started with creating what we call regional centers of regulatory excellence, RCOs. These RCOs are either a combination of academia and institutions that are regulating medical products, or they could be just academia or individual organizations that are responsible for medical products. But since the creation, we created these RCOs in 2015. Since their creation, we've seen also a lot of challenges in terms of sustainable funding, and also keeping up to date with standards that are needed for these medical products. So what would be needed is to establish a well-coordinated, strong, and an integrated system on the continent. So realizing that, in addition to us creating these regional centers of excellence, then we created what we call a College for African Regulatory Science Professionals. So this college would have three things. One of its objectives is to accredit and recognize causes, capacity building initiatives, and all these capacity strengthening systems that are already existing in Africa. Secondly, is also have a recognition system of regulators themselves and also recognizing the profession. Because one of the challenges that we have, regulatory science is a new profession. It has not been here for a long time. So now we want to also recognize it as a profession. Like, you know, when you say you know a medical doctor or the pharmacist, recognize the system, and you are able to get credible experts in these systems. But for regulatory science, this has not been the case. Therefore, we want to now deliberately establish a college that will then bring together the regional centers of excellence and sustain these efforts that we have tried to establish since 2015 when we launched the regional center of excellence.
As you say, regulatory science is a relatively new field. So, what global lessons can Africa leverage then when it comes to strengthening its own regulatory systems for medicine access, especially on the part of research?
Thank you very much. I think Africa, this is one point of advantage for Africa. We are coming into a space where the rest of the world has been implementing for many years. We have the first regulatory law was put forward, I think, in 1938 in the United States of America. And the US FDA in America has been regulating for over a century. So there are a lot of lessons that we can learn. And they've not only been regulating, but also they are implementing research as part of these science processes. The same also in Europe. Europe, they, I think, enacted their first law of regulating medical products in the 1960s. They created a continental system in 1995. And in addition to creating these systems, they also had research as part of these processes. So I think Africa should also go in the same direction, adopt this approach, but also learn. We do not need to invent the wheel. I think we can learn from these well-established global regulatory agencies, have not necessarily the same systems or the same modalities, maybe adapt them to our context. A lot of things have been done across the globe. I think we can learn from those lessons. And we have started with creating the African Medicines Agency. Even in the creation of this agency, we are informed by research, science-based kind of intervention.
Alex, thank you so much again for your valuable insights. I'm sure you're busy over there, so let's let you go to continue with your agenda. And thanks for your time.
Thank you very much.
That's Alex Juma Ismail, Senior Program Officer for African Medicines Regulatory Harmonization at the African Union Development Agency, NEPAD, or AUDA-NEPAD. So the African Medicines Regulatory Harmonization are facilitators of the SCoMRA that's happening in Mombasa, Kenya, the scientific conference on medical product regulation in Africa. Things have changed since COVID, hey? We want to come up with our own solutions now when we saw the whole debacle of vaccines either being too slow to come into the continent or they come and they're about to expire in 2 weeks and the whole hula baloo.
Well, by and large, I think what it told us is that we underinvested and we relied heavily on aid. And as soon as the US started pulling its contributions, we were exposed. And as you said, COVID-19, we're at the mercy of others.
Yeah.
Mix Vibration